Hello, my name is Dr. Laura Myers, and I'm President and CEO of Planned Parenthood of Metropolitan Washington, D.C. PPMW, as we like to call it, is the oldest and largest provider of family planning services in the entire Washington, D.C. area. For over 80 years, we have been providing family planning and related healthcare services to people throughout the Washington, D.C. area. We have 3 health centers, one located in what is called NOMA, a part of DC that is between Union Station and Gallaudet University. We also have 2 health centers in Maryland, one in Prince George's County and the other in Montgomery County. And so throughout this time, and it's been a difficult one, we have never closed. Our 3 health centers have been open, providing high quality healthcare services, and as well as promoting education programs that went virtual after the pandemic hit. Our programs empower individuals with information and tools so that they can make their own healthcare decisions about their own sexual health.
I am Dr. Serena Floyd, and I am an impact maker. So health services has been significantly impacted by COVID, and we've actually had to implement a lot of changes since March. Probably one of the largest changes that happened was that we implemented Tele-Health. That was a huge way in which we were still able to deliver care while still maintaining a high degree of safety for the patients and for the staff. Our doors were still open. We were still seeing patients who were coming in for primary care visits who had a need for acute GYN-related visits. We were still doing STI testing and screening, and still providing abortion services, and still providing contraception. When I hear the folks that thank us repeatedly for being here, for providing the care, the folks that are willing to navigate whatever new protocols we put in place, and however that might be a challenge, they're still willing to navigate that. But just at the end of the day, despite that, still very, very grateful that they can get what they need from us. That's when I feel the impact the most.
Hello, I'm Takina Wilson, the Vice President of Health Programs at Planned Parenthood of Metropolitan Washington, D.C. PPMW Health Centers are in the communities we serve, and we have been on the forefront of addressing systemic racist policies by continually providing high-quality, affordable health care. Since March of this year, the COVID-19 pandemic has affected our entire country. As of this taping, nearly 6 million Americans are known to have the virus, and a staggering 185,000 deaths have been attributed to the disease. And economically, 58 million people have filed for unemployment benefits. What is even more concerning is the disproportionate impact of this pandemic ravaging Black and Brown communities. According to the COVID Tracking Project, in DC alone, 52% of COVID cases and 74% of COVID deaths are attributed to Black individuals. This is startling when compared to whites, where they make up 22% of COVID cases and 11% of deaths in the nation's capital, respectively. Discrimination, healthcare access, economics, and other social determinants are factors which have increased risks for Black and Brown communities. And this pandemic, coupled with the nationwide reckoning around systemic racism, makes it very clear why the protests began and will continue. Importantly, this health crisis has further made clear the disparities in access to healthcare and how racists have used the right to low-cost, quality healthcare access to oppress Black and Brown people. While this oppression is not new, the decision being made around healthcare policy to strip away comprehensive coverage to these communities is more than sinister than ever. In a few minutes, you are going to meet a few of my amazing colleagues I have the pleasure of working with at PPMW. And while I wish I could introduce them all, I have to admit I am fortunate in that the diversity of our office mirrors the diverse population we serve. The fact is, more than 70% of our staff are persons of color who choose to ignore the negative media and walk past daily demonstrations in front of our health centers to ensure our offices remain safe, welcoming spaces so men and women and teens can access the care that they need. And this cannot happen without this group of panelists. We have a lot to unpack, so let's get started. Again, my name is Takina Wilson. I'm the Vice President of Health Programs at Planned Parenthood of Metro Washington, D.C. I'm going to moderate this discussion today with my phenomenal colleagues, and I'm going to let them introduce themselves, starting with Dr. Serena Floyd.
Hello, everyone. As Takina mentioned, I am Dr. Serena Floyd. I am a board-certified obstetrician gynecologist, and I serve in the position as medical director here at Planned Parenthood of Metropolitan Washington, D.C.
Thank you for joining us today, Serena. I would like to introduce my colleague, Dawn Collier.
Hello, everyone. My name is Dawn Collier, and I'm a women's health nurse practitioner and midwife at our 4th Street location.
And last but not least, I would like to introduce my colleague, Christian Jones.
Hello, everyone. I'm Christian Jones. I'm a family practice nurse practitioner and a primary care provider at PPMW.
So, Dr. Floyd, I'm going to ask you the first question. What are our health centers doing to combat the racial inequities in healthcare?
So our health centers are actually located in what have been designated as medical deserts. Nearly 60% of our patients are people of color, and 70% of our staff are persons of color. At the outset of the COVID pandemic, we had to make some really difficult decisions on how we were going to be able to continue to provide care, particularly to our patients who we know are specifically very marginalized. It was always an easy decision, though, to continue those services, which we believe would become very difficult to obtain, such as contraceptive care and abortion care. These were services that became no longer available at many other local healthcare sites as they shifted to a focus around COVID and managing COVID-related complications. We recognized, however, that this care is time sensitive and that those for whom basic healthcare has always remained out of reach due to historic and continued underinvestment and access to affordable care, we would still need to have these services. Likely probably even more than before. And we really wanted to ensure that Planned Parenthood was going to be there for the community. I think outside of COVID-specific related ways that we're trying to combat racial inequities in healthcare, a primary mechanism through which we're trying to reduce those inequities is through increasing access. Our scheduling allows for evening and weekend hours to better accommodate those who have difficult lifestyles and difficult schedules and find it hard to get in to receive their care. We have several different funding support systems for contraception as well as for abortion care. So those who really find it challenging to find financial ability to seek care, we can help to supplement in that regard. And in particular, two really big initiatives that we've taken on in the past year involve, three really big initiatives we've taken on. One of them has been our initiation of provision of gender affirming hormone therapy, as well as our initiation and implementation of telehealth services, which the COVID pandemic actually required us to step that plan and that implementation process up significantly. And so we implemented telehealth services, but also, always being mindful of the healthcare inequities that exist and the fact that there is a digital divide and access to the technology needed for telehealth visits is not always there for everyone. So we wanted to have telehealth as an option for those who could access it, but then also maintain the ability to conduct in-person visits, as well as being able to conduct visits by telephone, even if we needed to. And a really significant expansion to our services was the initiation of our primary care services, which you're going to hear some more about from my colleague, Christian Jones. So other work that we've been performing at the affiliate outside of what I have mentioned previously, we are actually part of a nationwide study on HIV testing and STI testing and treatment and how to specifically improve outcomes for people of color, taking into account how severe the inequities around those conditions are here in the DC area. Our clinical team and our education team work with the Washington AIDS Partnership on developing new initiatives around HIV pre-exposure prophylaxis and post-exposure prophylaxis that will help slow the spread of HIV and AIDS, which again, the district has disproportionately high rates of. Simply put, racism is a public health crisis. And how can we say this with certainty? Obviously after what Takina spoke about earlier about COVID cases and COVID mortality, and when you look at who is being disproportionately affected by that, you see that it is primarily individuals of color, particularly Black individuals. It becomes pretty obvious that we have serious problems around racism and healthcare in this country. But it's not just through COVID that we see this. We see it also through maternal mortality rates. We know that on a national level that Black women are 3 times more likely to suffer from maternal mortality than white women. And here in the district, the maternal mortality rates are twice the national average. So, that's a particular area around which we know that there are multiple factors that contribute to that, but racism is absolutely one of them. But we can even take it beyond conditions to looking at the policies that affect healthcare outcomes. When we look at how there have been such significant attempts at dismantling Obamacare with essentially no replacement for it, we see splintered proposals by the government or private industry that have either made it harder to get health insurance, do not provide preventative care, or create economic barriers by being more costly to patients than their predecessors might have been. So, ultimately, I think the government policies around restricting birth control access and abortion access are pretty significant places where we see these inequities, particularly because the individuals who seek these services tend to be disproportionately individuals of color, especially when we talk about abortion care. And so when there's undermining of any type of efforts to increase access, and particularly there are efforts to restrict access, we see who directly is being affected by that.
I'm going to switch over to Dawn, and I'm going to ask you a question. You're seeing patients on a daily basis, and I just want to know what are some of the ways that we are reducing barriers to patients seeking care?
Yeah, so as a nurse practitioner at our 4th Street location, I see patients for a wide variety of services to include cervical cancer screening, STI screening and treatment, problem visits, contraception, and gender-affirming hormone therapy, just to name a few. At the start of COVID, PPMW really jumped into action to find ways so that we could continue to provide care to our patients. Throughout this entire time, our doors have remained open while many were closing. And so pretty quickly, we started offering our telehealth services, really keeping our in-person visits for those who really need to be seen in person urgently. And even now, as some of the restrictions with COVID have started to relax, we're still offering our telehealth slots. Many of my patients really appreciate the ease of being able to have their appointment right from home or wherever they are. And it's still really great too for those patients who don't feel comfortable coming into the office because of COVID. We've also really started promoting use of our mobile apps. We have an app called PP Direct, which is great because patients can seek care for UTIs and contraception right from their mobile devices. And really even before COVID started, PPMW, I feel, has been kind of a front runner in breaking down barriers and reducing access to care. Just in these past 2 years, we've expanded our services to include gender-affirming hormone therapy, primary care, PrEP and PEP. And we also now offer services 7 days a week, which we also offer same-day appointments too, which allows us to reach a greater number of patients, and patients can be seen quickly in office if they need to be. We also have a contraceptive equity fund, which Takina and Dr. Floyd mentioned, which has been really great in subsidizing the cost of contraception for our patients. This year alone, we've been able to subsidize the cost of over 3,000 patients, which has been really critical in the face of COVID, given many people are probably experiencing financial hardships due to job loss. So now many patients can access things like LARCs, which are the long-acting reversible contraceptives, such as the IUD and implant. These are highly effective methods that are actually really costly, and so without insurance, it can be a real barrier.
Thank you, Dawn. Christian, I'm going to ask you the same question because you've been working all alone during the pandemic, and you're actually overseeing or working in our primary care department. And so your patients are a little different or present a little differently, but can you give us a story or tell us how that has been going for you during the pandemic and your patients?
Yes, I'm first of all very happy that we have had our doors open the entire time during the pandemic. I think that, like Dawn said, I get so many patients that are grateful for the fact that we're still here and our doors are open, that we offer telehealth visits so that they don't have to come into the clinic. I've had a good handful of patients, especially depression and anxiety patients, that are extremely grateful because I think with the pandemic and everyone being at home and self-quarantining, then they their anxiety levels are really heightened. Suicide, and I think to have the opportunity to talk to someone and maybe get started on some antidepressants has really, really, really been life-saving, literally, for them. So for that, I'm actually, it gives me a boost, actually. It makes me feel really good to be able to provide care for them, especially at this time.
Dr. Floyd mentioned that you launched primary care. Can you talk about why primary care is needed and how it addresses inequities in the District of Columbia?
Yeah, so having a primary care provider decreases your overall mortality and morbidity rate by 2 to 5% alone, just having a provider. And people of color are 3 times less likely to go and get a primary care provider. So for me, having PPMW here in DC is so important, having access to that care and longitudinal care, because DC is a predominantly Black community, and it gives us an opportunity to really support people of color, people who are underserved or underrepresented. I personally take time to discuss this with my patients, especially my Black patients, because I feel like we can relate to one another culturally. Our predisposition to certain disease processes, such as like hypertension and diabetes, are strongly attributed to like the foods that we eat and the seasonings that we use within our culture. So I feel like addressing these things and just making sure that they understand the importance of having primary care and lifestyle modifications is super important for them. And developing a relationship with them is really important as well, so that they can talk to me and come to me about certain things that they may not be as comfortable to talk to other people about. So I just think that like having PPMW in DC, where we really get to that community, it's super important.
So Dawn, I'm going to ask you the next question. Can you tell us about how we are able to help patients who are coming in with financial need to get their birth control?
Yeah, absolutely. So as I mentioned and Dr. Floyd mentioned, we have the Contraceptive Equity Fund, which I really want to highlight, allows women to access all contraceptive methods. So women really can have access to the contraceptive method of their choice without concerns related to the cost. We also have pricing for our adolescents, which is only $25. It allows them to come in and get access to STI screening and testing, to be seen for problem visits, receive their contraception. So it makes it a lot easier for our younger patients to come in without fear of how they would pay for these methods.
So I'd like to switch to Dr. Floyd now, and I have a question that I would like for you to address regarding stigma and related to Planned Parenthood. We've recently in social media heard Kanye West going off, and we're, here and there you're hearing Planned Parenthood in the wider and pop culture, and not in a flattering way. So I just want you to talk about how does that make you feel, and what do you think about those comments, and how do you debunk that?
Yeah, I think, Takina, when I hear that, I get extremely frustrated, even on the border of angry, because I feel like it is a severe misrepresentation of, who we are as an organization, and particularly who we are as an affiliate. You all have just heard, not only from myself, but from 3 other phenomenal Black women on this panel who have talked to you about the care that we're providing to our community on a daily basis, on the things that they come in and say to us about that care we're providing, the gratitude that they show us for that care, the respect that they feel is shown to them, and the non-judgmental way in which that care is provided. And I think, at the end of the day, whenever I hear detractors make comments that make it seem as though we are not out there in the Black community, serving in the Black community, advocating for and trying to make sure there's access to care, I think, all you have to do is, walk into one of our health centers on any given day, look around you and see who we're serving. Talk to our patients, get their perspective, listen to what they have to say about what Planned Parenthood means to them, because that is what is most important. The naysayers and the comments that they have to make oftentimes are not showing the least bit of respect for individual autonomy and for the fact that our patients are making difficult decisions often, or seeking care that is literally in some cases life-saving. And when you try to trivialize that down to making it seem like, as an organization, we actually are targeting the Black community for things like genocide, and other ways that are perpetuating racism and inequity, that's not the reality that we live in. And when I hear that, I get very frustrated, because I know, I see it every day that I'm seeing patients. I see it in the patients that I'm seeing, and their gratitude for the fact that we're here for them, when a lot of times there are many others who are not willing to be.
I just wanted to open it up and just find out, is there anything that you would like our guests to know about the services that you provide?
I just want to let it be known that myself and my colleagues, we really take pride in the care that we provide at PPMW across all service lines. Oftentimes I see women of color who are single mothers or on welfare, or who neglect themselves to take care of others. And I want the Black community, but especially the young Black girls and the women, to take advantage of PPMW being right in the middle of DC as a greater support system for themselves. We're here 7 days a week to provide birth control of all options, like we talked about, from birth control pills to IUDs. We can take care of your mental and your physical health. We provide effective and safe abortion care, where you can also provide safety for domestic abuse relationships. So, we really are here to provide care for you from head to toe. And I just really want everyone to know that we really do our best to be inclusive and to help people of color.
I really think it's important for our Black patients to see healthcare providers who look like them, just with the historical challenges the Black community has had with the healthcare system. I really want my patients to feel like their voices are heard when they come and see me. I'm really proud to work for an organization that's so diverse, and really prides itself in providing quality care to our patients. If you were to come in, you'll see our diverse staff. You'll see many Black and brown faces in our waiting areas. And these patients come to us time and time again because they know that we'll provide that quality care to them. It's compassionate, it's non-judgmental. A lot of my patients say that they feel more comfortable coming to us with these sensitive issues because they don't feel comfortable going to primary care providers for fear of being judged. A lot of my patients come in and say, this may be TMI. And I'm like, no, there's never any TMI when you come in and talk to us. I want to hear it all.
And I want to thank all of my guests today, my panelists, my colleagues, you phenomenal Black women. I am very proud to work alongside of you guys, and I appreciate you providing some information about Planned Parenthood today.
I am Victoria Ogunleya, and I'm an impact maker.
I am Rachel Browning, and I'm an impact maker.
My name is Tucker O'Donnell, and I'm an impact maker.
We believe all youth have a right to their bodies, have a right to comprehensive sex ed, and I think that that's something that we work on daily in order to meet those needs.
We have the most dedicated, engaging staff at PPMW. Every day we have new ideas.
The spilltheteas have both included Black women as the guest speakers who are qualified individuals to speak on the topics at hand.
SYP is the Summer Youth Employment Program. We currently have 8 youth who are really eager and excited to work with us for these next 6 weeks.
We realized that there was this need for one-on-one professional development, and COVID really allowed us to build that program and launch it.
We just did 400 safer sex kits as well as menstrual products.
It's always thinking about what's next, where can we move into next, and then centering the identities of the youth and young people and adults that need us most.
I am thrilled to have 3 sex education experts with us. Between them, they have over 35 years of experience in this field. And so they're going to share with us some of their experiences working with adults who work with youth or parents, as well as students, whether they're younger students or college-age students. Thrilled that they can be with us to share not only their experiences, but also their views on how we make an impact in the community every day. So with that, I'm going to turn to them to introduce themselves. Lena, why don't I start off with you?
Hello, my name is Lena Thompson. I work for Planned Parenthood of Metropolitan Washington, D.C., and I am a CLA program coordinator.
Victoria.
Hi, everyone. My name is Victoria Ogunleya. I work for Planned Parenthood of Metropolitan Washington, D.C., and I'm the health education coordinator.
And Rachel.
Hi, everyone. My name is Rachel Browning, and I am the manager of education at Planned Parenthood of Metropolitan Washington.
Thrilled to have the three of you talking about how PPMW Education Department is working with both students, young adults, college age students, as well as adults in the community. And so I'm going to start with you, Rachel. One of the things we know is that sex is everywhere, right? But having honest, well-informed conversations about sex is difficult because of the stigma associated with sex, and in particular with things like sexually transmitted infections or for example, HIV. And I know you're doing a lot of work on HIV prevention and education. Wondered, how do you combat that sense of stigma so that people can get that information, can have the space to have honest and forthright conversations?
Yeah, so I think it's actually really interesting. You know, we're in 2020, on the cusp of 2021, and although sex is everywhere, it's quite obvious that people are still either not receiving the message, which could be because of accessibility, and or are not receiving messages which are accurate. So, you know, when we think about combating stigma, there are basically three things in which I think need to happen at the most elementary level. The first would be meeting people where they are. I have a background in social work, and a lot of what we talked about early on in my program was understanding the context in which people are coming from. When you look at that, that actually helps you provide a better lens on why do people think certain things about sexual and reproductive health? Where are these ideas rooted or informed from? And so that's something that I think is very essential if you want to do this work. In addition, I think representation is also extremely important. Thinking about how we as educators show up in learning spaces, the identities that we hold, and how we can present those identities when we go into these spaces. Because to be honest, it really helps when you see someone who looks like you or that you have something in common with. And if you see them maybe trying to transmit a message to you, it might land a little bit differently. In addition to that, I would also say continuing to talk about the tough topics. You know, I totally agree that STD prevention is still very important as it was, you know, probably in like the 70s and 80s when we really first started talking about sex ed. Same thing with HIV prevention. But I think we can't forget about other messages that need to be tied in as well. Thinking about sexual orientation and gender, thinking about pleasure and how that shows up in sex ed. So I think that we need to continue to have these conversations that we've known from our, you know, quote, traditional sex ed, but we're just in a place right now where we can start talking about them.
So, Rachel, one of the things I know you've been doing is something called Spill the Tea. Can you tell us a little bit about what that is?
Yeah, so Spill the Tea started off really as being a meal series between people who identified as women, and that's women with an X. And part of what that series was focusing on was gathering people in a space where you could have these really informal but educational conversations about STD prevention, about testing, about healthy relationships, about consent, about how like gender identity even shows up in some of these things too, because all of this is intersectional. And so from there, Spill the Tea has kind of blossomed into its own thing very organically. We've done this now with people who will reach out to me who want to do it with smaller groups of people who already know each other. We've done it with people who were strangers and just kind of showed up to a spot, and we had these really cool conversations. We've partnered with local barbershops. We've also worked a lot with a lot of women of color who work in sex and sexuality to help provide additional information to the people who are attending these events. And then most recently, because of COVID-19, we've moved on to a digital platform on Instagram Live, hosting our Spill the Teas as well. So we've been able to continue the conversation.
Lena, one of the things I know you're very involved in is the CELA program. And I'm wondering if you could tell us a little bit about that. And I know that we do programs throughout what is called the DMV, the District, Maryland, and Virginia. But really, we also focus on certain parts of the DMV. I'm wondering if you could talk a little bit about that as well.
So I do a program called CELA. CELA stands for Sisters Informing, Healing, Living, and Empowering. It is a HIV intervention program for African American women or women who identify as a woman of color, ages 10 to 19. And so during CELA, we have a number of core elements that we teach our youth and our participants in our program. One of our values and how to be proud of being a Black woman and being a woman of color, how to amplify your voice and uplift yourself and your sisters. And then we also talk about communication and how to talk to your peers and the people around you. Also your significant other throughout your lifetime and your sexual reproductive journey. We also talk about all different types of sexual topics, about STDs, HIV, all of those 101s, and how to provide accurate information to them. We talk about healthy relationships and unhealthy relationships and how to recognize the differences. We have also adapted the program throughout the years to add different core elements that we found that the youth might benefit from throughout the years, one of which has been a huge hit and is with mental health. And so talking about how to take care of yourself and having self-care and doing little things every day to keep your mental health and on a good standing. And because not a lot of people think that mental health is a big deal, but in reality, our youth have talked about being stressed in just 11th, 10th, and 9th grade. And we have talked about how if you feel stressed now in just the 9th and 10th and 11th grade, your stress level is just going to higher as you get older and as you continue on in your education journey and your life journey and just overall. And so we talk about what self-care things work for them and how they can implement it every day and how they can just do little things to keep their mental health in check. And so we've also talked to and collaborated with other organizations, one of which is a wonderful young woman. Her name is Cara Anderson, and she has done yoga with our girls before, and yoga has been just a tremendous experience for the girls, because most of our participants don't actually get to participate in these things. And so our first experience with our yoga, we've had our participants just let go real tears and just having happy experiences and just letting out all of the stress and hurt that they might feel throughout their everyday life, and just having this space where they can come in and support each other and support themselves, and eventually having to advocate to gain all of these skills over time to have the strength to advocate for themselves and others and their sisters.
Thanks. One of the things that strikes me as I listen to you is how all of your programs lift up voices and also create these safe spaces for people to have conversations. And I'm wondering, Rachel, Victoria, Lena, any of you, what do you think the impact of that is on people's lives, on your program participants?
One of the biggest impact I believe that I have on my participants' lives is just giving them the the encouragement to know that they already have a voice. And so not to feel like that I'm giving them the voice to get, to advocate for themselves, but to know that they already have a voice within them and that we just need to help and uplift them to bring it out. And so that's one of the things that I really do focus on when I teach CLA and teach this curriculum, is to know that they, just have more within themselves to be able to do whatever they want to do within their lives. And so that's one of the biggest things that I have an impact on within their lives.
I would say the impact I have on the youth that I work with is just the message of really letting them know that they have autonomy over themselves, and that and the value of being authentic. So not only do you have control over yourself, but you are only you. Like, there's no other you in the world. And that's what makes you, I know, as cliche as it is, that's what makes you special. That's what makes you you. That's what makes you so powerful. So just not only uplifting them, their voices, but not even giving them power, because I can't give them power, they already have it. So it's more so having them tap into that power that they have inside of themselves, and really understanding, like, I am powerful and I do have autonomy over myself, and that I am authentic. And if I continue to move in this way, that, I can achieve all the things that I want, and all of these great things, and that my voice matters, my opinions matters, but also letting them know that, it's also okay to be vulnerable, that there's strength in being vulnerable, and there's strength in paying attention to how things make you feel and being able to voice that, as small as that is. And I think that impact really helps our youth, because it helps them then be able to focus on things that are a little bit more challenging. It's not so much a struggle of I have all of these emotions bottled up, or I don't feel as though I'm powerful enough to do X, Y, and Z. They know they are, and they're able to clearly express their emotions. So now they can go on and tackle bigger things in their community, because it's not those internal things that are holding them back. And I think that's the impact that I make when I'm working with our youth.
Some of the common themes here are harnessing power, autonomy, being comfortable with being vulnerable. And I think for me, that is part of the package of being liberated, being able to say, I want this type of relationship. I want this type of sex. I don't want this type of sex. I want to make my own choices about my own reproductive health. And I think that the three things which Lena and Victoria just kind of spoke to are the things that really make up a lot of our work, which, underneath all of this is to make sure that whether you're a youth or you're an adult, whatever the case may be, that you feel liberated, that you feel at the end of the day, you have enough of the technical knowledge, your self-esteem is where it needs to be, your self-worth is where it needs to be, you are sure of who you are, and you are coming as your most authentic self. And you also know that sometimes things aren't going to be great, and it's okay for you to be vulnerable in that way. And I think that nails down to liberation, that nails down to people really getting to the root of, you can have the life you want, you just need to go and make some decisions and take it.
One of the things that occurs to me is, when you think about the programs that you do, is there one or two messages that you hope the participants walk away with? What would that be? Like, I really hope this group of young women in CLA walk away with this, or the women who come to Spill the Tea walk away with this particular piece of information or message, or maybe it's a feeling.
That's a good question, Laura. I actually can't say that I wish I have one single message that I wish that all of my participants can walk away from, because all of my participants, depending on what area I teach in, have all different experiences. And so one group of youth that I work with need more caring and attention, and they just need more, affirmation that they're beautiful and they are loved. And then another group of youth that I work with might need just information on how to protect themselves sexually or how to navigate through an unhealthy relationship. And so I don't necessarily have a single message because I want them to know all of the core elements, but to more so, I want all of my participants to walk away and feel loved and supported. And so to make sure that they know that they can always come back to me and or my colleagues to talk about whatever or within, whatever they have going on. And it's been just that so far. So I've had, youth contact me after, way after CLA has already been over just to ask for, advice or assistance. And so I just want to continue on with that relationship and impact I have with their lives so that they know that they can continue to keep coming back.
Just wondering, when you're delivering a program and you're working with participants, what surprises you the most? Rachel, you're already laughing, so go ahead.
So the thing that surprises me the most is basically just, how I was laughing because if you work in sexual health education, you have heard all of the questions under the sun about anything related to sex and sexuality. So that was like the first thing, is like all these questions I've heard. But I also think, the thing that surprises me the most is a lot of the work that I do happens in groups. Even in schools, a lot of the programs that I do focus on like group learning models. And it's nice to see when youth come together to teach each other. And, unprompted, but just like one youth maybe knows more about a certain topic and that, they have the information already and they're teaching their peers. And to me, that is the thing that I like to see out of sexual and reproductive health education for youth, because, I am an adult, and although I still think, I got it to like work in schools, the best messages are going to come from peers. And when I'm not around, peers will be together. And if they can still give these messages to each other, that is going to help our work, kind of go beyond what we ever thought it could be. And, maybe that will also translate to conversations at home with parents or guardians. So for me, I love it when I see youth, kind of taking ownership of the material, taking leadership to educate others in the class, and not in a way of like, you didn't know this, I'm gonna make fun of you, but like, hey, let me just give you some quick tips on this thing that I know. And like, hopefully the message resonates.
I'm curious. You've talked about what keeps you going, what helps you be resilient. But I know that this work is very challenging. I know you have limited resources and limited people. What are some of those challenges?
So I would say some of the challenges with our work is a lot of the work we do is intersectional. So not only are we doing youth programming, but with that programming, we also find out that our youth need other resources to even be successful in our programming. It can be some things as food security. It can be housing security. It can be the need for more mental health services. It can be actual financial income, not only for them, but also for the program. The program needs funding. Sometimes we don't get all the funding we need to meet the needs of all of our participants. So if we were to have more funding, then we can bring in more mental health services. We can provide more food during our resources, during our programmings. We can probably partner up with others in the community who work on securing housing. And not to say that this is for every participant that we meet, but a large majority of our participants, they need a lot of their other needs met as well. So that's always challenging. I think Lena had brought it up once when she talked about how we started to bring in our yoga instructor into the CLA programs, that we noticed that, it wasn't that our youth only needed a safe space to relax and share their feelings, but they also need someone who was trained to come in and help them cope with those feelings and then figure out how they can navigate with those feelings in order for the program, the rest of our program in CLA to be successful.
Just another question. I think you just touched on that, Victoria, and that's the impact of trauma. And I know that trauma-informed care is now a buzzword. Can you tell us, what does that mean and how do you incorporate that into what you do?
So a lot of our education sessions are rooted in trauma-informed care, where we're just not coming in and teaching to our participants, that we're also getting to the root as to why they may think or react a certain way to what we're teaching them, and finding new ways to present that, to pay attention to the trauma that they're bringing in or starting out with, and not that we can heal their trauma, but also giving them the resources and tools they need to continue life with the trauma that they have, but then us being able to look at the way we teach certain things through the eyes of trauma. So a lot of the work I do is I teach a lot about intimate partner violence and teen dating violence. So when I am creating curriculum or having those education sessions, I'm always looking at it through the lens of trauma-informed care.
This is really challenging, right? We're a region with 5 million people. And I do know that one of the areas that you have sort of focused on are wards 7 and 8. And I'm wondering why wards 7 and 8, and what is that? What does that mean to focus there?
So I think when we think about 7 and 8, the first thing that comes to mind is accessibility. We know in the city that some people are disproportionately affected by a whole manner of things. And so, something that I will say we're very intentional about, and I think this expands outside of 7 and 8, and even looks at Ward 5, looks at parts of Virginia, parts of Maryland, and if we want to even go on a micro level, looks at subpopulations like people with intellectual disabilities, people from the deaf and hard of hearing community, seniors, all types of folks. But I think, we go where we know there is a need. We go where people feel comfortable with us coming to do the work that we do. And then we go there to build long-lasting relationships. We go there to, kind of ask people like, hey, what do you need? This is what we have. And if we don't have what you need, we'll make it for you. So, I think we do focus on 7 and 8, and I think a lot of things in the city are focused on 7 and 8, and I think that that's rightfully so. But I also think that just generally we focus on where we know there is a need, and that's where we go.
So with that, I want to thank everyone who's joined us today, to all of our viewers. I hope you have been inspired by the work of these remarkable sex educators, as I have over the years working with them as colleagues. If you want to get more involved in PPMW, please come to our website. It's ppmw.org, or our website, harderwerise.org, to either get involved, make a donation, learn more about us as we continue the fight to ensure that every single person has access to high-quality healthcare, but also high-quality sex education as well. Lena, Victoria, Rachel, thank you so much. Thank you for what you do every day in the community, now virtually, and thank you for joining us today. Goodbye, everyone, and thank you again.